Hello. You actually called me right after I was about to go into the patient's room. How you doing today? My name is Devin Gill. You're gonna be working with me today. That's cool. So, right before we go in, just give you a quick rundown about the patient. We got a 24-year-old male, had a motorcycle accident. He was a PT grad student going to school for physical therapy. So ironically, hopefully we do a good job because he should know what he's doing. He got a left frontal laceration and a contusion, a linear skull fracture, and a right basal ganglia contusion. So, and if that wasn't enough for his motor coordination, he's on Tegretol for his nerve pain that he's got from this, and that causes a loss of coordination and unsteadiness too. So we're gonna have to work with him a little bit. He stayed in acute care for a while. While he was there, had some increased intracranial pressure and severe spasticity that developed on his left side. His mother is fully available to help with his caretaking process, but he's max assist with all his ADL, so we're gonna have to work with him on some basic things just to make transfers more safe. His mood, cognitive behavior is a little inappropriate at times sexually. He swears at times, but that's just a part of the brain injury that we're gonna have to deal with. The limitation that I'm gonna be working on today is his static sitting balance, because he has essentially no static sitting balance unless he's holding on to somebody's hand. Now, if he's a student, then he's gonna have to sit up in a chair on his own. If he's being transferred from one place to another, if he can sit up on his own, that'll make things a lot easier for people to get things in place. You can possibly do it with just one person instead of with a nurse or anything like that. Like we said, his mother is gonna be the primary caretaker, so we gotta make this as easy on her as possible. The impairments in body structure that we're gonna focus on is whenever he's laying supine, if he starts to move his body on his own actively, he goes into that spasticity where he begins to lock up on his left side in a fetal position. Because of that, he's got a severe posterior pelvic tilt. Sacral seating is also what we call it. And it's from being in that fetal position for so long in the bed because he hasn't had much activity. He couldn't have much activity at this point. He was still recovering. In the left lower extremity extensor synergy pattern, we're going to try to break that synergy. Why? Because if we start actively contracting those muscles and it goes straight into, that synergy pattern, he's not going to get much functional mobility at all. And if we're trying to get him to statically sit on his own with his balance, having a leg extending and doing those things is not going to help that at all. It's going to force him to go right back into that fetal position that we were talking about, trying to get him out of. So, like I said, trying to do this, getting him back to his role in society as a student, but I mean, of course, just getting him so that he can be more independent with any of his ADLs. The most independence that we can get from him is going to be the better, because his mother is going to be the primary caretaker. We know that she's going to have a lot on her plate dealing with this emotionally, so the easier that we can make this on her, the better. How we're going to work on that is we're going to work on some static sitting balance, rhythmic stabilization, just trying to push forward and behind, get him involved in some coordinated activities to try to re-synergize his brain to those type of things. We're going to try to engage those paraspinals so that he can actually have more core strength and stability so that he is able to sit up on his own. That'll give him some privacy in the bathroom if he can sit up on his own. That'll give any of his caretakers some peace of mind if they can actually step away from him without him completely falling over. And the second thing is, once we've worked with him in that seated position, we want to lay him down in supine. We're going to start working on some bridging. Okay. The reason why we're working on bridging is because that's going to be another way to get rid of that posterior pelvic tilt, and it's going to engage that core to get more core strengthening, and hopefully we can get active contraction in the lower extremities while we're blocking his feet so that we can block that synergy pattern from kicking in. So we can get some active muscle contraction without the synergy pattern kicking in for his lower extremities. Okay? So we're going to build strength in his core, get some coordination without the spasticity, and hopefully break some of those synergy patterns as well. He's a Rancho level 5, which means he's got a low attention span, may not know why he's here, what day it is, things like that. So we're gonna try not to overload him with the instructions and commands. We're gonna try to keep the stimuli down, which is why it's only gonna be me and you. Too many people would set him off. And then we're gonna give him frequent rest breaks so that he doesn't get overwhelmed, okay? You ready? All right, let's go.